survey. What is the general impression that I see of my patient?
Okay, you see a woman approximately in her 60s sitting on the couch. She's now sitting up and she is guarding and holding her abdomen.
So she's obviously speaking to me?
She is. She's talking to you.
Okay, so she is alert.
She is.
Okay, excellent. And when I ask her name, what is her name?
Her name is Betty.
Excellent. And why did you call 911 today, Betty?
She called because she said she was taking a shower this morning around 7 a.m. and she started having this sharp pain in her abdomen.
And Miss Betty, how old are you?
She's 68.
Okay. All right, at this point in time, I know what her chief complaint is. She's telling me that she's having abdominal pain, right? Is her airway open? Her airway is open because she is speaking to me, right? She
Yes.
is breathing on her own.
She is.
I'm also simultaneously going to have my partners get a set of vital signs for me. Can you give me a blood pressure, pulse, respirations, SpO2, and a blood sugar?
Okay, they're working on that right now.
Okay, excellent. And then what is her skin color? What's her skin color look like?
Her skin appears pink, but it's a little cool to the touch and a little clammy.
Okay, and her radial pulse, what is that?
It's regular and strong,
Okay.
and your partner comes back with vitals now, and her pulse is 102.
Okay,
Her blood pressure is 200 over 120. Her respirations are 18 and a little shallow.
okay,
Her blood glucose is 104 milligrams per deciliter.
okay.
Her oxygen is 98% on room air, and her temperature is 98.6.
Okay, so as far as the breathing goes, she is breathing on her own and her oxygen saturations are at 98% on room air. So I don't see at this point in time why we need to actually treat her with any oxygen therapy, so I'm going to withhold that. I am going to upgrade the ALS to an emergency response, and also, what is their ETA?
Their ETA is 20 minutes, and they advise that traffic is heavy in their area.
What is the ETA to the hospital?
Your ETA at hospital, you're about 10 minutes down the road from a
Okay.
facility.
Then at this point in time, let's go ahead and cancel the ALS, and we will go ahead and transport our patient emergency response to the hospital. And we're actually going to load and go on this patient because I'm concerned that she might be having a medical emergency. Okay. So as I proceed further into the history taking, we're going to get the patient onto the stretcher, into the back of the ambulance, and again, I'm going to reassess signs and symptoms and ask her. So on her pain that she's having in her chest, or excuse me, in her abdomen, can she with one finger point where her pain is at?
Yeah, she points in the center of her abdomen, just above her navel.
Okay, and is this the only place that pain is at, or does it seem to be moving anywhere?
She says she also has lower back pain.
Lower back pain. And does anything make this pain better or worse?
Anytime she moves and walking around makes it worse.
Okay, and in her own words, have her describe this pain to me.
She describes it as a sharp pain and a somewhat stabbing pain.
Okay. And on a pain scale of 0 to 10, 0 is no pain and 10 is the worst pain in the world, what number would she give her pain right now?
She gives it a 9 out of 10.
And of course, she said this pain started around 7 o'clock this morning. Is that correct?
Yes, so it started approximately 2 hours ago.
Okay. Now I'm going to proceed to ask her about allergies. Does she have any allergies to medications?
She is allergic to lisinopril.
So that clues me into maybe thinking that she's got problems with blood pressure. Does she have a history of high blood pressure?
She does have a history of high blood pressure.
What other kind of medical problems does she have?
She has aortic stenosis. Her doctors told her she had that a year ago.
Okay.
She's had a history of a heart attack. She has high cholesterol, and she takes metoprolol and Lipitor.
Okay, very good. So what about, when was the last time she had anything to eat or drink with this?
She had dinner last night, but she did not eat any breakfast this morning because she wasn't feeling well. She just took her medicines this morning with
She
some
did
water.
take her medications with the water this morning.
Yes.
Excellent. And has she been taking her medications regularly?
Yes, she says she never misses them. She takes them every morning.
And has she been able to eat and drink regularly?
Yeah, she says that's been fine for her.
Okay, excellent. And then what was she doing when all this started?
She got up at 6 a.m. and she took a shower around 7, and as soon as she got out of the shower, she started noticing this pain in her abdomen.
Okay, excellent. So what I'm going to do now is I'm just going to examine her and listen to her lung sounds. What are her lung sounds?
They are clear and equal bilaterally.
Excellent. And as I examine, I'm always going to look first, then listen with a stethoscope, and then feel or palpate the patient. There's no need for me to palpate the chest, as this is not a trauma patient. So now I'm going to come down into the abdomen, and I'm going to look at the abdomen. Is there any distension or discoloration, or there's any kind of life-threatening issues with the abdomen that I see?
The abdomen looks normal and it's non-distended.
So is it soft, flat, non-tender?
It is soft.
Okay. So when I listen to the abdomen, do I hear any hyperactive, hypoactive bowel sounds or any other adventitious sounds?
Bowel sounds are normal, but you do hear a whooshing, brewy sound in the center of her abdomen above her belly button.
Okay. And then as I palpate all four quadrants, do I have any rebound tenderness in the right lower quadrant?
No.
Okay. Do I have any other tenderness on any of the other four quadrants?
Oh, it's tender in the center above her navel, and you feel a pulsating thrill, above the navel as well.
Okay. All right. And then I'm going to go ahead and check comparable radial pulses. When I compare both radial right and left pulses, are they equal bilaterally?
They're equal, regular, and strong.
Okay, and then I'm also going to have my partner get a second set of vital signs, but at this time I want him to get it on the opposite side that he checked it on, because I'm trying to confirm a possible aortic aneurysm.
Your second set of vital signs is blood pressure 188/100, pulse is 98, regular and strong, respirations are 16 and somewhat shallow, blood sugar is 103 milligrams per deciliter. Her lung sounds are still clear and equal bilaterally, and she is 99% on room air.
Excellent. So this also, at this point in time, I want to get some other pertinent history from her. I want to know if she's had any other symptoms, any nausea, any vomiting, any diarrhea or constipation. Also want to get a sense of if she's got any other medical problems that might, like an appendix, gallbladder, either some kind of colon problems. I'm trying to get an idea of other etiologies or diseases that might be causing this, the symptoms that she's having today. And then I will reassess her every 5 minutes and try to keep her warm with a blanket, treat her for a possible aortic aneurysm, and then I am going to continue to transport emergency response to the hospital of her choice, and then I'll give a verbal report to the hospital.
Okay. What is your verbal report? Go ahead.
Okay, hospital so-and-so, this is medic so-and-so. I'm en route to with a 68-year-old female patient that called this morning for abdominal pain. She says it's an 8 out of 10 on the pain scale, 10 out of 10 on the pain scale. And then it is radiating to her back. She does appear to have a pulsatile mass, as well as she's hypertensive at 200/100, a pulse rate of 100, respiratory rate of 16 and shallow. Her O2 sats are 98% on room air. We do have an ETA of about 5 minutes. If you don't require anything further, I'll give you the rest of my report upon arrival.
Okay, we'll see you upon arrival.
Okay, that concludes my assessment.